Today we are covering how to master the next generation NCLEX unfolding case studies. These are the heart of the NGN, presenting a single patient scenario that evolves across 6 separate questions, designed to test your clinical judgment in real time. Think of it not as 6 random questions, but as one continuous clinical encounter that unfolds screen by screen. Let's walk through a typical example to understand the flow. Your first question introduces a 68-year-old client admitted with an exacerbation of heart failure. The screen provides a nurse's note with vital signs, lung sounds showing crackles, and visible peripheral edema. The question, likely a matrix or multiple choice format, asks you to identify the most significant findings. Here, the exam is testing your ability to recognize relevant cues from a sea of data. You need to connect the crackles, edema, and vital signs to the diagnosis of fluid volume excess. On the next screen, the situation changes. You are given a new piece of information, perhaps a critical lab value like a high BNP, or the patient's oxygen saturation drops to 88%. The question now asks for the most appropriate nursing action. This is where a common exam trap appears. Students often choose a passive action, like document the findings, but the NGN demands active clinical judgment. With a dropping oxygen level, the correct answer is an intervention, such as raising the head of the bed or applying oxygen. The case continues to unfold. The third screen shows that you have received a provider's order for intravenous furosemide. The question might be a drag and drop, asking you to place the steps for medication administration in the correct sequence. It is testing your procedural knowledge, but within the context of the specific patient's situation. After your intervention, the fourth screen presents new data. The patient's urine output has increased, and their breathing has eased. The question now asks you to evaluate the patient's response to the furosemide. This tests your ability to connect your previous action to a subsequent patient outcome. You must analyze the new data and determine if the intervention was effective. But the scenario isn't over. The fifth screen introduces a complication. Another major exam trap. A new lab result shows the patient's potassium level is now 3.1, a direct result of the diuretic. The exam is testing if you can recognize a new problem that arose from your last intervention. Your priority must shift from fluid overload to addressing the electrolyte imbalance. The correct action is no longer about breathing, but about managing the low potassium, such as notifying the provider. Finally, the sixth question moves toward a later stage of care, like discharge planning. It may ask you to identify key topics for patient education, such as diet, daily weights, and when to call the provider. To succeed, use the simple mental shortcut, AIE and Evolve. For each of the 6 items, assess the new information, determine the priority intervention, and evaluate the outcomes. The Evolve part is crucial. You must let your thinking evolve with the patient's condition from one screen to the next. The patient on screen 6 is not the same patient from screen 1. Remember that you can always click back to the electronic health record to review previous information. So the test is not about memorization, but about continuous, evolving clinical judgment.